Hi, I'm Dr. Roadhouse, and glad you're here. This is the Ask Dr. B show, and Dr. Roadhouse with Roadhouse Chiropractic. Today, my guest is Dr. Renee Mayer. She's a medical doctor, and she also treats with natural methods, including acupuncture. So today we're going to explore all the possibilities and try to teach you as much as we can on acupuncture. And Dr. Mayer will get into that in a little bit. So if you know anybody that's having any trouble or they're interested in acupuncture, share this with your friends. And let's try to get as many people out there knowing more about acupuncture. And by the time that you get done talking or listening to what Dr. Mayer has to say, there's going to be a lot of health problems she's going to be able to help you with. So why don't we sit down and let's talk first of all about your training.
Okay, thank you for inviting me.
Sure.
I started out in graduate school studying endorphins and enkephalins. I did a master's and PhD in pharmacology, and when I did that, endorphins and enkephalins were very new, popular, and I was very fascinated by the pain control aspect, natural pain substances produced in the body, and how that could change how we practice medicine. So after graduate school, I went to OU Medical School and completed training there. Spent a number of years working in the cancer practices in Tulsa, working with cancer patients, blood patients. One thing I noted was there were a lot of side effects from the treatment, and we needed to keep people on their treatment. After that, realizing that, I decided to go study acupuncture at Harvard. They have a course specifically for physicians, and I completed that course, came back to Tulsa, and integrated it into my practice. Then I eventually opened my own practice called Lifestyle Medicine, so I could take the things that I had learned, the areas of interest, and put it together in one practice.
Good. So another thing too is, when you talk about endorphins and enkephalins, that like my 16-year-old son says when he watches a show, sometimes he goes, "Dad, can you dumb it down a little bit? Because sometimes I think you're talking about Russian or something like that." But endorphins and enkephalins, a lot of people have probably experience this. If you do any kind of extreme exercise, that's when you hit that wall, you keep going, and your brain produces endorphins and enkephalins, or morphine-like substances, natural painkillers. So that's what you talk about. And when you say that in your postgraduate, you actually have a PhD in pharmacology.
Yes, I do.
So she's one smart cookie. So anyway, what we're going to do is we're going to find out how to use the acupuncture in your office today.
Okay. So there's many, many conditions that acupuncture treats. It's really quite amazing. And once I started studying it and realized it's not just for neuropathy, it's not just for pain, because the basic premise of acupuncture is to restore the natural function of the body. So there's flow of energy, we call it qi, that's a very simplified description. But the acupuncture points, which are very stable, traditional, reproducible, we work with those points in certain conditions to restore the normal flow of energy in the body so the body can do its own healing. And in my practice, I work with a lot of chronic pain. I work with a lot of chronic conditions. So there's chronic thyroid problems, there's autoimmune problems, there's fibromyalgia, peripheral neuropathy, absolutely, yes.
So a lot of people call it acupuncture, but it's actually meridian therapy. And there's different types of meridian therapy. So what are the types that you use? Do you use the traditional needle? Do you use electric, non-electric, non-needle,
right.
Tai Chi? There's a bunch of different things. Moxibustion, we were talking about that.
Yes. So I studied Japanese acupuncture, and that's a structural palpation-based acupuncture. So if I lay you on a table and examine you, I can feel areas that are not quite normal. And so by finding the point that releases that abnormal feeling, that's where I'm going to put the needle. But it expands more than that. Years ago, they used to put an herb at the end of the needle and light it, and that would accentuate the treatment. We don't have to do that anymore. Now we have electric current. So we can use that along the acupuncture points. And I have a special machine that will allow me to do...
What's that called?
It's called an Accutron. It's not a TENS unit. It's a very sophisticated machine with pre-programmed protocols and some that I can come up with myself. And I use that on the acupuncture points.
Okay, and you do some needle if it's indicated, right? Okay, all right. So just kind of give us an example on some of the cases that you've treated, like in the last couple of weeks.
I have a concussion protocol. So patients that have, one lady, she fell off a horse, very symptomatic for almost a year. Within a short period of time, she started to notice relief of her headaches and dizziness and so forth. One lady was a violinist, had carpal tunnel treatment, or carpal tunnel symptoms. We treated her with needles and pads, and she resolved quickly. Allergies, it's a big allergy time if you're in Tulsa. And there are points in the face, and most people aren't comfortable having needles in their face. But I can use a probe on those points and get significant relief.
Well, so as far as the type of things that you treat, you know, like from your medical perspective, there's limits on chronic disease as far as what medications can really help the patients. So give us a little bit of information. How can you help when like medicines don't work, or the conditions that you've seen that medicines don't really work but you're able to help with?
I think the best way for me to explain that is the concept of a branch and a root. So many times how we treat people in medicine, we deal with the branches and we try to deal with symptoms, but in acupuncture, we really try to get to the root of the problem. So I try to find out what the core problem is and then deal with that as well as the symptoms.
Okay, good. So one of the reasons we're doing this show is this is a really good treatment, and a lot of people are a little bit scared of, say, the needles. Like me, I'm a big baby when it comes to needles. So I'm going to have Dr. Mayer stick some needles in me so I can show you if a big baby like me can handle what you guys can do. Because a lot of times that stops people from actually getting the treatment that they need. So I want to show you that. And I've never had it, by the way. I've had my blood taken out and almost passed out several times. So the ambulance is waiting out front. And the first thing I'm going to say is, I know my wife is watching. She's going to probably wonder, how did you sneak out of the house with that shirt? She hates this shirt. But I wanted to make it so that you could do, I have a problem right here, my elbow and my shoulder from ballet class, and so I need to have you help me with that.
Did you fall?
No, I didn't fall.
Okay.
Just
stretched too much, okay.
I went that way and my arm went that way. Oh boy.
So the needles in acupuncture are not hollow like they are for drawing blood. And typically there's not a worry about infection, but I do still use a little bit of alcohol. And we use a little guide too. Okay. All right, do you feel the plastic pressing on you?
No.
Okay, the needle's in.
Oh.
Did
See?
you feel it?
No.
Okay.
We're good.
So I'd like to do just a couple more. It's your needle, or it's your knee, no, your elbow and your shoulder, right?
Yes. So while Dr. Mayer is putting those needles in, just want to let you know in the next couple of weeks, obviously she's doing some acupuncture. I mean, next week we're going to have a massage therapist that's going to do some different massage techniques, lymphatic drainage, and also she uses some essential oils. After that, we're going to have Dawn here, and she's going to do the cool sculpting, which is a way to freeze the fat and your body actually gets rid of it. We're going to have a dermatologist, because as chiropractors, when we examine people, we see their backs, where you mostly, you don't really look at your back that much, and we find suspicious moles. So probably have them check me for some suspicious moles. After that, we've got a physiatrist, which is a combination orthopedic doctor and a neurological doctor, but non-surgical. And he's going to talk about using your own stem cells for injuries and neuromusculoskeletal problems. And probably the most famous person that's had this is Kobe Bryant, and so he'll be here. And so they'll be demonstrating. I don't think I'm going to have him demonstrate the stem cell on me. So, but anyway, so I didn't feel a thing. Okay, so that's good. All right.
So the next thing we're going to do, you have needles in at certain points, and these are the electrode pads. We have a special program in our machine. We kind of set this up in advance so that it would operate quickly. We're going to put the electrodes on and start the treatment. And then, if you're willing, Dr. Benhouse, I would like to do a sinus treatment.
Okay, sure. That's good. That didn't hurt a bit.
Okay.
So anyway, if you know someone out there that's having any kind of neuromusculoskeletal problems or having any chronic situations that they're not getting better, share this video. show Dr. Mayer some love, give her some hearts and thumbs ups. Oh, we have a couple questions while we're waiting on this. Actually, we have several questions. Since we announced that, our email's gotten flooded. So this one is from Melanie Lawrence, and she wants to know, I'm sure cases vary, but how long does an acupuncture treatment last before another one is needed?
Most of the time, it takes a couple of treatments. Because the problem didn't happen overnight, sometimes takes a while to correct. But I've had patients have significant relief with just 1 or 2 treatments, but then sometimes it's a series of treatments. When I see a patient in the office, the first visit, I do an evaluation, and that typically can be billed to their insurance company.
Well, so most people that go to an acupuncturist, it's not covered by insurance.
No, in the state of Oklahoma, neither Medicare nor commercial insurances cover acupuncture.
But when they come in you because you're family practice, internal medicine, then you're doing intake because you're checking them for other reasons that they could, and you're ruling out other diseases before starting with the treatment. So that evaluation, you say, is covered. Okay.
So if you come to me for, say, neuropathy, I want to make sure there's not an underlying medical problem that could be causing the neuropathy.
Yeah. So if you haven't, that's a good thing to know because most people don't know that. And this way they can cover both bases at the same time. They can make sure nothing else is going on and they're at the right place at the right time. Okay. Yes. We have another one. Let's see. Oh, okay. They want to know, this is from Jerry Kurtner. How to know a good acupuncturist?
I would say be referred.
Yeah. I think that's with anything that you're doing when you have other patients that are satisfied and they tell that's the best way. Sometimes patients don't know, and maybe you see a Facebook live show and then maybe you find Dr. Mayer that way. Sometimes it just happens that way. Okay, could it help fibromyalgia? You already talked about that. You have to evaluate them and check them. Could it help restless leg syndrome? That's neurological. So you have to evaluate them, but there's and then cost if not covered by insurance. Well, we just covered the first one, and then after that, how would they go about that? It's probably on an individual basis.
Yes,
isn't
it is, depending on how many modalities we use.
Okay, good.
Okay.
All right.
Are you okay if I treat your face?
Yeah, I am.
All right. So I think what we'll do is go behind you here. So there's acupressure and acupuncture points on the face, and starting on the top of the head, forehead, and going all the way down. So what we do, yes.
Is it okay it's making that sound?
Yes, it's supposed to make that sound. And really, you shouldn't feel anything. Some people feel a little bit of...
No.
So it's just 12 seconds on each of the points that I'm going to do. I'll do it a little bit quicker because we don't want to. So I'll go down these points, and some of them are overlying the sinuses. And then if you take your glasses off, this is definitely where people would not want me to put needles, but the probes aren't going to hurt you. Some people feel their sinuses opening when I do the treatment. And of course, they're a little bit longer in each place. And then we go across the face like that.
Okay. So this time of year, I know that the allergy season, especially in Oklahoma, I saw one time on CNN that Tulsa, Oklahoma, because of the jet streams, got rated the #1 worst place in the United States to live if you have allergies and sinus problems. So this would be something, because with your background in pharmacology, talk about some of the effects of long-term use on the steroidal inhalers and some of the medicines that they typically use, on patients with allergies, and how they have to keep taking it.
Right. I'm not opposed to medication.
Oh,
I think there's a great place for them. But if we can avoid using steroids, which can cause problems with the immune system, can cause problems in your mouth if you use an inhaler. So if we can minimize the use of of medications while still getting rid of the allergy symptoms, that's beneficial to the patient.
Good. Okay, so as far as acupuncture, I mean, give us a little bit of history on acupuncture or meridian therapy. I mean, because some people think it's been around for a while, some people really don't have any knowledge of it. And talk about the difference, after you do that, talk about the difference between the Chinese and the Japanese.
So acupuncture is a very ancient art from countries like China and so forth. And they knew years and years ago, thousands of years ago, they knew what the different meridians were. It really didn't become popular in this country until around the time of President Nixon, when they did those China visits, and there was a news reporter that needed to have his appendix out, and they used acupuncture for the anesthetic.
I remember seeing that video. That is unbelievable. No anesthetic. They just put and the patient is actually awake.
Right, and so
Right.
after that, it was kind of very unique timing, because that happened, and then one of the physician that was with President Nixon, he actually proposed to the NIH that acupuncture be studied. At the same time, on the East Coast, there was a group of researchers that had identified the opiate peptides. So it just kind of went hand in hand, and there was a big rush of research on that.
Well, if you want to see that, you should Google that, because that is amazing. That's when you see, if acupuncture can, you can do surgery while the patient's awake and they don't feel anything, it's going to work for it, and there's something to it.
Right.
So anyway, okay, so we had another question come in, and we want to know is acupuncture safe or meridian therapy safe for pregnant women?
I'm very careful about treating pregnant women, because it can induce labor depending on where you treat. So that's on a very much case-by-case basis, and I would obviously work closely with their obstetrician.
And it would depend on what they're having. I mean, obviously, if they're having back pain or headaches or sciatica, I mean, chiropractic is really effective right now. We have several pregnant women that we're taking care of, and they get good results. So I know that a pregnant woman, I mean, especially, from the second trimester on, can be very uncomfortable, if not in pain, and maybe not sleeping good. So anything we can do to alleviate any of the symptoms naturally, because they can't really take a lot of drugs. They're not supposed to anyway during that time. And if we can help them with a safe alternative treatments to make them feel better, you know what it is, mama's happy, everybody's happy. Okay, so as far as I want to talk about the concussion protocol, because there's so much in. I have a couple patients that have been in the NFL, and they've got these balance issues and their memory, and there's this big study going on, and really there's not a whole lot of help that you're going to get from traditional medicine. Basically, it's kind of a wait and see program.
Yes.
And there's a lot with functional neurology, what we do, but I want to hear about what you do for those patients, that have concussions.
Well, first of all, I want to make sure they've had a good workup. If they needed an MRI, I want to make sure they get it. Then I also am in working with fatty acids, because brain function, essential fatty acids. Yeah. And then my machine has a built-in protocol for treatment of concussion. And I use the pads for that. I do use some actual needles as well. And we've had very good success with that. So it's about a 40-minute treatment. And depending on how severe the patient's symptoms are, it may be once or twice a week. And then we follow them, their headache, just that foggy feeling they get. If it's a concussion that happens immediately, I'm very much in favor of the concussion protocols that are used by the NFL now, putting in the cave and things like that.
Yeah, dark room, because you got to let the acuteness simmer down before you can do anything else. But I'm talking about the long-term stuff. That basically, one of the famous cases is Sidney Crosby, who plays for the Pittsburgh Penguins, and they kept waiting and waiting. He's like one of the best players in the league, and he's not getting better. And so finally, he went to Dr. Carrick, the Carrick Institute, and I saw the video on there, and there's all these ex-NFL and NHL players. I mean, they couldn't hardly walk, and they were shuffling around, had headaches, and they're just terrible. And to see them, the progress that they go through, but he did the same thing, and they actually have an article that said how they saved his brain by doing this treatment, because the wait and see approach, especially if they've had multiple ones, they actually have to have some treatment. But anyway, if you know anybody that's interested in acupuncture, please share this. I know Dolores Buckaloo shared it. Thank you, Dolores. And Judy Ennis shared it, so thank you. There's other people. Jeremy Josserand, thanks for liking our information. Jill Massage from Missouri, thank you for watching today and liking. So is there anything else that we might be able to educate patients on? Oh, I know. How about the addictonology stuff? People that are addicted to smoking and drugs. There's all kinds of studies coming out now that there are so many patients that are I mean, we're right here at St. Francis. Right across the street is, the Laureate Brain Center, and a lot of those patients that are in there, they'll have back pain or neck pain or headaches, and they send them over here because when they're in treatment, they don't want them to have any drugs at all. But this is something that you might do, because I just read an article, a research paper on this. So why don't you talk about how needle acupuncture or the electrical acupuncture helps with that?
I personally believe that the role of acupuncture is part of a team. So it's not the total end-all treatment, but it's very effective. For example, in smoking, which has an addictive component to it, there's places in the ear that we can acupuncture, and which helps with the cravings. And then we work with the patient in dealing with the habit. So there's certain behavioral techniques. So it's a combination of resetting things in the different acupuncture points, and then working with their behavior. With the release of endorphins and enkephalins, the need for pain medication is sometimes greatly reduced, and then we deal with the underlying problem, and then the need for pain medication goes away.
So I've seen some articles on this, and some of them, they have these little pads that you could put in the ear and have a little round thing with like a little spike on it, but it doesn't hurt. And they have it there, and so that when, especially in the beginning process, that they actually go in there and stimulate that.
Right.
Explain that. I mean, why do you have to do it so frequently?
Some people do it when they feel those cravings, so they've got it in the right place, maybe a certain point, maybe this point right here, and they've got a little point inserted, and so when they feel that craving, they'll go rub on that point to take the craving away. And there are acupressure points that you can deal with yourself. So I teach patients when they're ready to get a headache, when they know they're getting a headache, which points to work on so they can alleviate the headache without medications. So patients learn how to work the points.
So this is something that they could come into your office and do, but then also they can do some, because you always want to try to give the patient something to do at home to help improve.
Yes.
And do some of those patients, do you find that when they come in to see you that they've already been maybe under some psychological training or treatment with a psychologist to help you with the underlying? If they don't, do you refer them?
Yes.
Okay, all right, because that's a huge component. You have to break the cycle. But the big thing is that grip that addiction gets on them, and that's the hardest thing to break, so that helps with that.
Right.
Okay, good.
Exactly.
Now, what about, have you ever had any patients that have had plantar fasciitis? Because I have a lot of runners, and we do pretty good with them, but there's sometimes that they just don't get all the way fixed. I mean, what do you do for that?
Needles are very effective for that.
And if you're worried about needles, look at these needles here. I completely twist them a little deeper. I'm okay with the way they are right now. But anyway, I mean, if you have a problem with needles, I mean, I didn't feel them when you put them in. I completely forgot all about them until I looked over and saw that one with my peripheral vision. So if you have a problem, or you think you have a problem with needles like I do when I get my blood drawn, this is nothing. I mean, I didn't feel it going in, and there's no problem at all. So if you're scared of it because of the needles, then don't worry about a thing. And you say that there are some times when you have to put the needles in the face, right?
Right, and I minimize that. I would rather use the electrical treatment on the face. And we actually have a facial rejuvenation program. Years ago, they used this machine to treat Bell's palsy. It was very successful on a woman, and she came back into the office and she said, "Could you please treat the other side of my face?" Because it lifted it. So now we have a facial rejuvenation program working in the acupuncture points on the face, and it actually works to renew the skin.
So you're a little reluctant to put the needles in the face. Is it because they're more tender, or?
Yes, and I don't want to. I mean, I can do it, but I think patient comfort is, you know.
I think that if I had my choice between these and my face or that, I'm going to vote for that right there.
Most
'cause
people
it's,
would.
It's going to be a lot easier.
Mm-hmm.
Okay, so if you know anybody, you know, that's interested in acupuncture, tag them or share this broadcast. So as far as you know, weight loss, is there anything you can do with acupuncture weight loss? Because I mean, if you think about, like, you know, pain control, and then weight loss, and then smoking and alcohol addiction, if you take those three things, you're going to be able to help a lot of people. So what would you do for pain? I mean, not just the acupuncture, but the whole spectrum.
So we have a program in our office. Yes, we can use acupuncture for the cravings, but we really need to help people how to change their lifestyle. Teach them what healthy fats are, what a healthy diet is, and exercise. So it's about movement, it's about stress control, and proper eating. So you can't just, some people think I can just put in 2 needles and fix them.
Yeah.
No, it's about changing your lifestyle and learning what a healthy lifestyle is.
Yeah, I had this one patient that was referred to me by her family physician, and she had sciatica, and he says, I want you to talk to her about losing some weight. So anyway, one of his nurses was a patient. She said, don't talk to her about losing weight until after you're done with the sciatica, because she won't come back, you know. So anyway, I got rid of the sciatica, and I was talking to her about it, and the education, you know, as far as foods go, is amazing, because she thought, because she was eating fat-free ice cream, that as she was eating like a half gallon of it a night, because she thought it was fat-free. And whenever it's fat-free, it means it's got a lot of sugar in it, and
Absolutely.
Sugar is really more of a culprit than
Absolutely.
you know, the fat itself. But it comes down to reprogramming. There are certain individuals that can get addicted to carbohydrates, and so then they eat it, and then they want it again. And there's actually some studies done with GMOs that talks about that it creates a craving for them. So there is a lot of things with the internet that you can go out and really educate yourself and find out about all these different things. So anyway, what would someone do if they wanted to come in and see you? I mean, how would they get a hold of you? I mean, I guess we need your number or something like that.
My practice is called Lifestyle Medicine. The phone number is 918-488-9874. I have wonderful staff. Cynthia's here with me today. Judy's back at the office, and they'll help you set up an appointment. And the first one's an assessment. We try as much as possible to build that to your insurance, and then after that, talk about what treatment options are available.
So when say a Medicare patient comes in, I mean,
I take Medicare.
You can bill that to
Yes.
them too.
I can't bill the treatment,
Right.
but the
But
assessment.
the evaluation, make sure nothing, especially with an elderly patient, you want to make sure that there's, you know, I mean, they're at higher propensity to have problems, so we have to rule those off. Well, good. Well, anyway, I appreciate you coming. I think what we'll do in a couple months is we'll have you come back and we can talk about some other stuff. You know, so if you want to see Dr. Mayer, then you can look her up. What's it called?
Lifestyle Medicine.
Lifestyle Medicine. You got the number here. We're going to put the number in the comment section. So if you want to get over, I'm sure if they Google it, they can find it too, right? Okay. So anyway, thanks for coming by. I appreciate it. I think it was fun. I hope you learned some stuff. If you learned some stuff, like it, share it. And also join us next week when we'll have a massage therapist on, and she's going to talk about essential oils. So if you're interested in essential oils, I know nothing about essential oils, so I'm really excited to have her on. So until next Tuesday, we'll see you at 12 o'clock. Thanks for sharing.